Hello everyone. Today I am going to tell you everything about the procedure of embryo transfer in IVF. Embryo transfer is the final but the most important or crucial step in the entire procedure of IVF. It just takes about 3 to 4 minutes, but these are very vitally important minutes. It is because even if your embryos may be top quality and the endometrium lining could be excellent, but if the procedure of embryo transfer, that is conveying the embryos into the uterine cavity, is not done properly, not at a proper place in the uterine cavity, the embryos will not implant and the result may not be as we want. So what do we do exactly? In embryo transfer, we do at our center what is known as ultrasound guided embryo transfer, which allows you to actually observe the movement of the catheter which is preloaded with the embryos, so that we can deposit the embryo at a desired location in the uterine cavity. It also allows the passage of the embryo transfer catheter most atraumatically without damaging the inner lining of the uterus. We tell the patients, you can come for embryo transfer even with food also. You no need to come in a fasting state for embryo transfer. We tell the patient to report about 2 hours prior to the appointed time for embryo transfer and not to pass urine. We desire the bladder to be half filled with urine so that we are able to watch the endometrial cavity under ultrasound guidance in a better way. It also helps to straighten out the angle of version between the uterine corpus and the uterine cervix, so that the embryo transfer catheter doesn't have to negotiate the angle very forcefully. Once the patient is given a proper position, an ultrasound guiding cord is placed on the abdominal cavity and the cervix is located. We watch the cervix. Any extra mucus plug on the cervix is wiped out or sucked into the sterile syringe, and our embryologist brings the embryo transfer catheter, which is preloaded with the number of embryos which we have already decided before. Normally at our clinic we transfer single blastocyst for women under age of 37 and 2 blastocysts for women above the age of 37. However, there could be other determinants for the number of embryos to be transferred, such as previous uterine surgeries, previous attempts at IVF, embryo quality, etc. But we, under no circumstances, we transfer more than 2 blastocysts at our center in the uterine cavity. In young women, always a single blastocyst. And then we pass the outer sheet of the catheter and the ultrasound guidance to about 2.5 centimeter below the fundus of the uterus, which is the point of maximum implantation potential. And the preloaded embryo transfer tube is then guided through the outer sheath to the desired location, and the embryos are released under vision by myself, that is IVF consultant, into the desired location by just giving a push on the plunger, and the catheter, outer sheath and the embryo loaded tube are then synchronously, gradually removed from the uterine cavity and handed over to the embryologist to watch under the microscope to see whether all the embryos have been released into the uterine cavity or the embryo has not been released. If there is any embryo which is still not loaded, which is still found loaded onto the embryo transfer tube, we redo the procedure again. So you can observe this procedure very well in the video which follows this talk. And certain instructions which we give after embryo transfer is that you need not bed rest. Patients walk out of our clinic within 15 to 20 minutes of embryo transfer. Please see to it that the medications which we give after the embryo transfer, called as luteal phase support, are completely understood by you and you do not miss any medications. No bed rest is absolutely necessary. You can have any food of your choice as long as it is cooked at home, so as to avoid outside food eating, infections, etc. And there are no special restrictions on your activities imposed by the procedure of embryo transfer. After about 14 days of embryo transfer, we do what is known as serum beta hCG, that is your blood pregnancy test, to find out whether you have become pregnant or not. So this The entire procedure of embryo transfer is carried out without anesthesia and the patient is awake because there is no discomfort at all for the patient during the process of embryo transfer. In fact, many of our patients are watching the procedure of embryo transfer live on our ultrasound screen. So this was the procedure of embryo transfer which I have explained to you right now, and you can watch the procedure of embryo transfer in the video attached after this my narrative. If you have any questions even after that, please feel free to ask me in the box mentioned below, or you can call our center, and we will be very happy to answer your questions. Thank you very much for watching the video.